Hi there, I'm Dr. Stephen Fallon. Welcome to this video. Today, I'm going to answer another questions answered video from one of my webinars. This is also from my Master Your Case Acceptance webinar. And the Master Your Case Acceptance webinar is basically A to Z training on case acceptance. So it's basically my system from start to finish for case acceptance for comprehensive dentistry types of cases, whether it be veneer cases, implant cases, partial or full mouth rehabilitation cases. This system works in a general practice because I've used this for the last 20 years in my practice. And so this question comes from Dr. Stephanie Pass, who asks, do you believe showing before and after pictures play a big part in the treatment acceptance in your practice? And I would say it's huge. It's absolutely, I think, the biggest part in my case acceptance. That and showing the patient pictures of their own mouth. So these two things, I think, are some of the foundations for case acceptance. And so I always encourage my members of my training programs, Occlusion Design or Velocity Elite, for example, to really improve and develop and refine and just get better with clinical photography, because it's huge for case acceptance. It's also huge for online marketing of your practice. And to get them started, though, with Velocity Elite, we give them a series of these photo books. And these photo books have my own cases, before and after pictures of my own cases. And they can be really powerful to show what can be done with dentistry. And this is what I use in my own practice, are these photo books. So the members have had really great success using these photo books in their own practice, in their own practices. In fact, we've got some testimonials about this. I could put some below this video, or a link to a page with some of them below this video, where they talk about using the photo books and in their practices. And the bottom line, though, is showing before and after pictures and what can be done with this type of dentistry, especially when you have a whole bunch of them like in these books. Inevitably, some of these pictures look like that particular patient, and showing them what could be done on a similar patient's case is huge for their visualization of what can be done for them. And that's, I think, a big part of our success. I learned this when I was a young dentist doing my AACD accreditation. For AACD accreditation, we had to take a full series of photos before the patient started their treatment. And so what I thought is, I'll just show the patient these pictures and we'll talk about the treatment. And so I took all these photos, and I was using a slide photography, because with the AACD accreditation back in the 90s, you had to have slide photography. So I had a little slide projector machine with a screen below, and I could click through each slide and show them on the screen their slide. And what I noticed is people would look at the pictures of their teeth and they'd see different angles. And I'd have an idea of what I want a treatment plan for the patient, but they'd inevitably say, oh, I don't like the way that looks, or I don't like the way some of those back teeth look. And they'd ask for more dentistry than I even had treatment planned, because they just saw their mouth in a different way. And they wanted everything, when they saw this, a lot of people wanted everything just fixed. And no old amalgams, no cracked teeth. You know, they just wanted everything more ideal. And so I clicked on me, I'm like, wow. When I show patients their teeth, their before pictures, they actually ask for more ideal dentistry. Awesome. You know, it helps them because they're getting better dentistry, and it helps me because I'm easier to treatment plan and present a case when the patient's already asking for this treatment. So it was really good. Very good realization. And it led me now digitally to basically have a series of before and after pictures that I show most of my case consultations. After they've completed records, we see the patient for another treatment planning consultation, where I have their pictures, and then I show before and after pictures of my own cases, which inevitably have some pictures that are similar to their case. I actually made this also for Velocity Elite members. It's the USB drive, which is the before and after case slides that I use in my practice. And we've got one for full mouth rehabilitation cases. We have one keynote presentation for structurally compromised teeth, one for full mouth rehabilitation cases, one for veneer cases, and one for implant cases. And it's all on a USB stick in this box. And we have Keynote, but we also have PowerPoint because I recognize not everybody's on a Mac, although you should be. No. Yeah, so because of that, I've made PowerPoint plus Keynote presentations. And we'll talk about a question I commonly get asked about using my pictures by my Velocity Elite type of members on the next video, because I think that that's an interesting question and a good one to answer. So for now, if you would like to watch my case acceptance webinar and see my system in action, so to speak, because I show a case presentation during that webinar, you could go to phelandentalseminars.com/myca/reg. Although we have another one which shows the page with members talking about their results with the case acceptance books, and that one is phelandentalseminars.com/mca-results. So maybe I'll link to that one. But either way, that is basically case acceptance, and that's using photo books. I'd encourage you, if you're not taking really good clinical photography of your cases, to do so. And part of that is editing. Not many people edit their videos, and I have a simple 4-step system for editing that takes 20 seconds, which I share during with the members. So I would encourage you to edit your videos, take multiple shots of each angle, because sometimes some are better than others, slightly in and out of focus, better exposure for whatever reason, flash is firing differently. I take multiple shots of each angle and I edit the best one. And I think that if you started using photos in your case acceptance system, would hugely increase your results in your practice and help you help more patients. That's the bottom line. So thank you very much, and I'll talk to you soon. Take care.